Hey there, welcome. Today we are going to do a quick tutorial on the various types of syringes and needles and how to draw up medication properly and safely. So just to give you kind of a quick recap, this video will actually go hand in hand and go along very nicely with a video I made a couple months ago, I want to say, that was medication administration, and it goes over a little more in depth the various types of gauge sizes for needles and syringes and the different injection types and angles and things like that. But today I'm going to really show you what that looks like. So I have quite a few things in front of me here. I have some syringes. I have a couple different size syringes. This is a 3 cc or ml. Remember, cc and ml are exactly the same thing. This is a 3 cc. This is a 1. Okay. I have 3 different needle sizes. I have a 25 gauge 1-inch needle. I have a 23 gauge 1-inch needle. Sorry if you can't see that. You'll see them closer here in a minute. And then I have a 20, I think this is a 21, 1.5 inch needle. I also have some of my fake medication. Now this is saline in a vial, but I'll be able to show you how to draw from a vial. I have my gloves, and I have, of course, my alcohol prep pads. So just to get a closer view at this, let's go ahead and do that real quick. Okay, so here is our 1 cc or 1 milliliter syringe, very tiny, and when I open it up here you will see that it is calibrated in tenths of an ml. So there's 0.1, 0.2, 0.3, so on and so forth. That's for when you need a little or a small amount of medication versus a larger amount. This is your 3 ml or 3 cc syringe. These are probably typical of what you will use very, very commonly. These are calibrated in half ml, so it's 0.5, 1, 1.5, 2, 2.5, and so on. This is your 25 gauge 1-inch. There's also a 25 gauge 5/8 inch that I call the baby needle. You'll use that quite often on babies. This is a very tiny, very thin needle, because remember, the bigger the number, the smaller the needle. This is your 23 gauge 1-inch, very, very common for a lot of injections, especially IM injections. This one can be used, this 25 gauge can also be used for subcutaneous injections quite often. But this 23 gauge 1-inch is great for IM injections, deltoid, even glute on smaller individuals, but this is a great one for that. There's also a 23 gauge 1.5 inch, 1.5 being the length, that's great for glutes as well. And then this is your 21 gauge, bigger needle, longer needle. This is a 1.5 inch. This could be a glute if you have a medication that's maybe a little thicker, because a lot of times the thicker medications you need a larger gauge needle, just because I always compare it to trying to push a golf ball through a garden hose. If it's thicker, it needs a larger gauge in order to come out properly. Okay, so now that you've seen all of those, we're going to go ahead and we are going to put our gloves on. We've washed our hands at this point, right? And we are in, probably in most offices, we're inside of the room, the med room, where we have medications that we draw up to go and administer to our patients. Okay, so we've got our gloves on. We never want to handle medications without gloves. We have our vial of our medication. We're going to check real quick to make sure the expiration date is okay. We haven't expired yet. This one is a brand new. It has the lid on it. Now, if you have a multi-dose vial, meaning you'll pull several doses out of the same vial, once you open it or uncap it, you are going to want to go ahead and take a pen and just on the label somewhere date it and initial it so that you know when it's been opened. Different offices, different clinics are going to have various policies against that. Kind of a rule of thumb is 30 days, but some may have other policies. So you just want to make sure you have that written down. I always go ahead, before I do anything, I go ahead and I open up at least partially my packaging. I don't open it all the way because this is sterile inside of here and I don't want to just lay it down on a counter. But this helps me to not have to fumble with it or fight with it. Now for a lot of instances where you're going to be drawing up medication to go and give to a patient, administer to a patient immediately, you are going to want to draw up with one needle and then give with another. Now, you of course want to check your policy with your particular clinic to decide whether or not you want to, you're going to do that. Some clinics policy is for that, some it's against, some don't have a policy on it. But go ahead and make sure that you are able to know what your policy is as far as that goes. It's always just a good idea because even though you're just puncturing this once, you don't have to dull the needle that you're going to give with. You don't have to try and recap the needle that you're going to give with, because if you think about it, if I were to use, say, this needle and I'm going to draw up and give it with the same needle, well, I have to put the cap back on to transport it to the patient, and that's just not safe. We should never recap a needle. Now, there are going to be some instances where you might have to do that. TB skin tests may be that, because a lot of the TB syringes come with the needle already affixed to it. You can't change them out. In which case, I'll show you how to safely do that. And that would be a clean needle situation. Clean meaning you haven't stuck the needle in a person yet. You should never, ever, 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 and I can't stress this enough, recap a dirty needle. A dirty needle meaning one that you've already used on a patient. So I'm going to go ahead and do it the way I have always known to do it, which is to draw with one and then switch them out and give with another. So let's say we're going to give this medication with a 23 1-inch because it's appropriate for the patient and the medication. Which again, if you watch my other video on medication administration, I kind of talk about what's appropriate and what's not. I'm going to go ahead and get an alcohol prep pad, because even if this is brand new, not opened, you still want to clean it off. Okay, so I'm going to go ahead. I'm going to pull my syringe out. I am going to what I call prime it before I do anything, which is just kind of pull the plunger in and out a few times, because that's rubber in there, and when they're brand new, very often they stick, and you don't want to be fighting with it. I'm going to go ahead and attach this to my syringe, and I'm just going to leave it in the packaging like that for now. What needle do you use to draw up with? Well, some places have a policy for it. What I've always done is I just use the needle that we don't use as often, which in this case, a 21 1.5, you don't use quite as often in most areas. So then I'm going to go ahead and I'm just going to pop this right off. Once this is off, it gets thrown away. You don't put it back on there. Okay, I'm going to go ahead and I'm going to clean the top of my vial. And on a multi-dose vial, you're going to do that every time right before you draw up. On a single use, you're still going to do it, but the single use vials, literally you're going to draw everything out of the vial, and then the vial is going to be thrown away. Okay. All right. So I have my syringe with my needle on it. This is the safety device here. You always want to pull the safety device back, before you uncap the needle, because if you leave it up and you uncap this needle, now you're going to have a bare needle sitting there, and you're going to put your finger here to pull this back to get to it, and you may risk sticking yourself. So always pull your safety back first. If it's this type of safety, there's some different kinds. And then the way I uncap a needle, I always pull this way. You'll see some people go like this. This to me is a little dangerous, and you can actually, run your finger across the needle, which compromises the sterility of it, not to mention you could stick yourself. So pulling like this is far better way to do it. So you're just going to uncap your needle, okay? Now you'll see some people do this, okay? It's not that it's wrong. It's just not safe to me. I know my depth perception is not the greatest all the time, and I could stick myself trying to do this. So what I feel is far safer is just to put the vial on a flat surface and then stick your needle into it. Now, before you stick your needle into it, and again, this doesn't have to be done this way, but it's always good to pull some air, about the same amount that you're going to be drawing up. So say you're going to draw up 1 ml. Pull 1 ml of air into the syringe, because then once you have the needle into the vial, you can push that air and it makes it a lot easier to pull up. Not to mention you don't get as many bubbles that way. Go ahead and take this, hold on to your vial. Go ahead and put that into your vial, and then in one motion, bring it up, okay? And at this point, you want to just make sure that, and I don't know if you can see this, the needle inside the vial is below the level of the fluid or medication. Okay, we're going to go ahead and push our air. And then if you watch, it kind of almost does it on its own because I pushed that air in there. Okay, but I'm going to go ahead and I'm going to now draw that up. Okay, I always go just a little beyond. And if you look right here, it's the top of the plunger you want at the mark that you need. Okay, not the bottom. I've seen people make that mistake. So I always go just a little beyond what I need. Then I'm going to turn it back down, put it flat on the surface again, and pull it out. Now here is where I can flick, I can tap, you can use a pen to tap it, just to get any air bubbles out. But you also want to, at this point, possibly just push just that little bit of air out. You might lose a little of your medication, but that's why you go just beyond. Then I'm going to go ahead and I'm going to safety this. A lot of these are designed to use a thumb, and that may be the way you've been taught forever. Again, not wrong. I just feel it's safer to use a hard surface. So when I safety a needle, I go ahead just on the edge of the surface, and I go ahead and do it that way. That way I don't risk sticking myself, okay? Then I'm going to go ahead and I'm going to grab the other one that I'm going to give the medication with, give the injection with, get that ready, unscrew this guy. We're going to toss him into sharps, okay? Which I don't have right by me right now. We're going to go ahead and screw this one on. And you can either leave the plastic on or just take it like this into the patient's room or wherever you're going to give the injection. But that is it. That is how you draw up safely and successfully. And then you would just go ahead, take your medication. If your office uses a tray or something, you might put it on a tray. Take some more alcohol swabs, some gauze and things. Band-aids will be in the room for you. And you are all set and ready to go. So if you do have to recap a needle in the event that you have needles that maybe come already affixed to the syringe or something like that, I do want to show you how to do that real careful, real safely. So let's say you've already drawn up your medication, okay? Put the cap on the flat surface, okay? Take the needle and don't grab a hold of it, don't do this, because again, could have that really bad depth perception like I have. And just simply scoop. Don't touch the table with it or the countertop, but just simply scoop that up and then you can click it on there. Okay, let's do that one more time. We're just gonna scoop, okay, and then go ahead and click it down on there. And that's how you safely recap a needle. Thank you so much for watching. And if you haven't already, as always, please drop a like and subscribe to my page. I really, really appreciate it, and it really helps me out. Thank you so much, and we'll see you next time.